All right. Hi, everyone. Thank you so much for joining KABC and Weber Elder Law Office for today's training on navigating Medicaid and Medicare coverage for long-term care costs. A few house rules before we start. If you haven't already, please mute your speaker or your microphone. If you have any questions during today's presentation, please type them in the chat or unmute yourself during the designated time. I will help monitor the chat, and Karen will ask for questions throughout the presentation. All materials and a recording of today's presentation will be available in a few days and be emailed out to each of you. If you need any assistance, please type in the chat and I'll try my best to help you. Before we begin today's training, I would like to take a few minutes to introduce you all to those that are new to KABC. My name is Libby Hastings, and I'm the Communication and Public Relations Coordinator for Kansas Advocates for Better Care. I want to start off with a brief history about our organization. So KABC's history begins in 1966 with a lady named Petey Cerf of Lawrence. She had been regularly reading to a nursing home resident who was blind and had both feet amputated. One day, the woman was ill and calling out, "I can't breathe, I can't breathe, I can't breathe." A nurse entered the room and told the patient to shut up, you're always yelling. A few days later, Petey saw that patient's name in the obituaries. That horrible experience led to the founding of Kansans for Improvement of Nursing Homes. Now, a group of 6 women, including Petey Cerf, from the Topeka and Lawrence area, came together to organize conferences, phone and meet with concerned citizens, and really bring to light the mistreatment of nursing home residents. They were originally met with hostility from state officials who had previously received all of their information about nursing homes from the nursing home administrators themselves. But they eventually piqued the interest of Governor Bennett, who began a series of surprise visits to nursing homes. He found quality care in some and some serious problems in others. Now, Kansans for Improvement of Nursing Homes, or KINH, helped pass 2 significant pieces of nursing home legislation in 1978, including a law authorizing a civil penalty against nursing home owners for uncorrected violations affecting the safety, nutrition, or sanitation of residents. Now, while our organization has changed and evolved over the years, including our name to Kansas Advocates for Better Care in 1996, our mission has really remained the same, and that is to advocate for the fundamental right to be treated with dignity, respect, and to receive quality long-term care. Here at KABC, we're dedicated to improving the quality of long-term care for older Kansans at home and in residential care settings. We envision a Kansas where all older adults enjoy excellent quality of life and care, no matter where they choose to live. Now, what exactly do we do at KABC? I like to divide what we do into 3 different categories: our empowerment, our advocacy, and our resources. We empower older adults and their families to make decisions about long-term care. Through emails, phone calls, personal meetings, we can connect individuals with helpful resources to really navigate the ever-changing landscape of long-term care and all the problems that may arise. One specific resource that we have is called our Consumer Information Reports of Kansas licensed adult care facilities. And I've got an example of one of those in a few slides that I'll show you. So we can help you translate those detailed health and safety reports on specific long-term care facilities for those individuals and families who are ready to take that next step towards facility level care. We also provide an extensive collection of online and print resources. We keep the community up to date on long-term care legislation and trends, and we provide educational training, such as the one that we're at today. Previously, we've done some trainings on person-centered care, positive approaches to dementia, and elder abuse, and we also host an annual caregiver training in the fall, usually in September. Another big portion of KABC is our public policy advocacy. So we advocate through public policy initiatives, and we're very active legislatively throughout the year, and especially during legislative session, which just started this Monday on January 8th. And very quickly, I just wanted to highlight a couple of the stories of individuals and families that we've assisted over this past year. We've noticed that we've received quite an increase in the number of calls regarding the use and abuse of antipsychotic medication as a restraint, especially in folks with dementia and other dementia-related diagnoses. And we've heard more calls about the financial exploitation of older Kansans. And as I mentioned, I just wanted to point out really quickly what that consumer information report is that we offer at KABC. These reports include information such as current and past administrators, management history, the three most recent inspection survey dates, the number of deficiencies cited, if a facility is a special care unit for Alzheimer's or dementia, and more. So we can help individuals translate these reports, and we can email them out to you or mail them out to you or walk you through them over a phone call. And quickly, before we get going with Karen's presentation, I just want to ask that you stay connected with us. We've got a couple QR codes here. One's for our Facebook, one's for our website, and one's to sign up for our e-newsletters and other emails that we get. And here's just our contact information here. And I'll also go ahead and put that in the chat for you all. And now on to our training with Karen Weber. I'm going to give a quick introduction of Karen before she gets her presentation started. Karen Weber is an elder law and special needs lawyer licensed in both Kansas and Missouri. She practices in the areas of estate and Medicaid planning, special needs trust planning, guardianship and conservatorship administration, and probate. Karen has been practicing law in the Kansas City area for 28 years. Ms. Weber is the past president of the Johnson County, Kansas Commission on Aging, and she is the co-founder and past president of the Kansas chapter of the National Academy of Elder Law Attorneys. The Weber Elder Law Firm was honored as the Woman-Owned Business of the Year through the Kansas Department of Commerce in 2001. In 2012, Ms. Weber was selected as a finalist for the Kansas City Business Ethics Award by the Society of Financial Service Professionals. In 2008, Ms. Weber was selected by her peers as a Kansas City Super Lawyer Rising Star. She is a frequent speaker at professional and public events discussing the topics of elder law and special needs planning. Ms. Weber received her Bachelor of Business Administration degree with honors and her Juris Doctor degree from the University of Missouri at Kansas City. She enjoys scuba diving, swimming, and reading for pleasure when she is not serving her clients in her community. So now I'm going to turn it over to Miss Karen Weber.
Thank you, Libby, for that nice introduction. And welcome, everyone. We're delighted that you're with us this afternoon. We have two topics to cover today. We're going to spend about 15 minutes talking about Medicare's coverage of long-term care, because that's about all you get from Medicare. That's my effort, a little long-term care humor here. We're going to spend 15 minutes talking about when does Medicare help pay the expensive nursing home, and then we'll spend the rest of our time talking about Medicaid. And that's because Medicaid does pay the majority of the cost of long-term care in our country. So Libby and I have planned to pause every 10 to 15 minutes to take questions and comments from the group. I hope you'll have some good questions or some good stories to share with us. If you have a question or a comment that just can't wait until one of our scheduled breaks, by all means, jump in, raise your hand, unmute yourself, share your question. Alternatively, we're going to have questions and answers in the chat format as well. So we're glad you're here today. Thanks for tuning in. Let's see, am I sharing my screen? Here we are. So topic number one, what are the general rules for Medicare coverage of our nursing home costs? And by the way, folks, the average cost of nursing home care in our region is about $9,000 a month. That's $108,000 a year. I think that's why we have so much interest in today's topic, is so that we can talk about when can we expect Medicare to help pay the expensive nursing home bill. Little spoiler alert here, Medicare will pay for a maximum of 100 days of nursing home costs. That's a maximum. Many of my clients receive 20 or 30 days paid for by Medicare. And so we do have this 100-day maximum. I want to confirm that for you this afternoon. You may all be aware that Medicare doesn't pay much for nursing home. There's a 100-day maximum. But there are three requirements, all three of which need to be met in order for Medicare to even pay for 1 day of nursing home care. So let's talk about those Medicare 3 requirements for the next 10 minutes or so. At the end of this slide, we'll pause and take some questions. Medicare's first requirement is that the individual must have a hospital stay, and it must be a hospital stay as an admitted patient for 3 days. So what do we mean with this requirement one? What that means is for individuals who might enter into the nursing home or memory care directly from their own residence, there won't be any Medicare coverage. Medicare only helps with the nursing home bill if the individual has first had a 3-day hospital stay. Okay. One other item to know about this first Medicare requirement, the 3-day hospital stay. I think it's helpful to know that often the first 24 hours, if a person is taken to the hospital through the emergency room, which is the most common way to enter hospitals today. When an individual enters the hospital through the emergency room, oftentimes the first 24 hours, the person is there under observation status. They have not yet been admitted to the hospital. And that's important for our discussion today in order for Medicare to pay for any of the nursing home bill. We have to have a 3-day hospital stay as an admitted patient. Okay. And a lot of times the ER doctors and all the other hospital professionals providing excellent care, many of those individuals are not aware of this 3-day admitted patient requirement for Medicare coverage. So I think that all of us can share this information with our family members, loved ones, clients. We have to have a hospital stay of 3 days. That's Medicare's first requirement. The second requirement for Medicare coverage is that the individual must enter into the long-term care arrangement, the nursing home, the rehab, the memory care, within 30 days of that 3-day hospital stay. What do we mean by the second requirement? What does it mean? The individual must enter long-term care within 30 days of the 3-day hospital stay. Oftentimes, the admission to long-term care is directly from 4 days in the hospital, go into long-term care, not much of an issue for discussion. But sometimes individuals who have been treated in the hospital, and if the physician has determined that some physical therapy or occupational therapy or speech therapy, if there are some rehabilitation therapies that are needed, the healthcare professionals may allow the individual to go back to their private residence, especially if they have a spouse or other supports in their residence. Many of my clients will leave the hospital, go home for the rehabilitation efforts. And if that rehabilitation doesn't go as well as they would like, or maybe as well as they had expected, as long as the individual makes the decision to move into institutional rehabilitation care within 30 days of that 3-day hospital stay, there's a chance that Medicare will help with coverage of the first 1 through 100 days of rehabilitation. So that's our second Medicare requirement. It's really Medicare's third requirement that leads to not a lot of coverage. And that is because Medicare only pays for rehabilitation care in the long-term care communities. Medicare does not pay for custodial care in the nursing home. So that third requirement, in order for Medicare to pay, the individual has to be receiving some sort of rehabilitation. And that is slide number 1. That should get us started on our first 10 to 15 minutes discussion. I think I saw some comments in the chat. Let's see. Lori, thank you, Lori, for your comments. Lori wants to say, I'm sorry, but Medicare doesn't pay for nursing home care. It's skilled nursing care based on the preceding hospital stay. It's never good to say Medicare pays for nursing home care because it confuses people. Lori, thank you for your good comment here. I often use these terms interchangeably, and folks like Lori will remind me we really want to be more precise in our terminology. Long-term care is kind of an umbrella term. For the title of our program today is long-term care. I think of long-term care as an umbrella that includes skilled care, as Lori's referring to, rehabilitation care, even assisted living care under the HCBS Medicaid program is under the umbrella of long-term care. So thank you, Lori. I'll try and be more careful with my word choice. If you catch me flip-flop, and I hope you'll jump in and share your good comments with us further. We have another question. If the spouse passes and children are beneficiaries of assets instead of the surviving spouse, will Medicaid go after those assets? And so we haven't yet got to our Medicaid question, Chris. I promise you we will. Chris, we're going to cover this a little bit later. Okay, so I'm going to save your Medicaid question for just a little bit later. It might be answered in a part of our regular slide presentation. If not, we'll make sure we answer it for the group. And Lori's jumping back in. Lori wants us to know that it's usually only if the person has Medicare and a supplemental insurance, almost never a Medicare Advantage. Lori, I really am grateful you're with us. I hope we might have a chance to visit at the end of the program. I've got a question about the 60 days necessary to restart a second 100 days of Medicare coverage. And maybe Lori will be our Medicare expert that can help us with those questions. Anybody else want to jump in with a question or a comment regarding Medicare's coverage of skilled nursing care?
I
Okay.
have a question. What distinction are you making between rehabilitative care and custodial care?
Yeah, thank you. So the question is, what is the distinction that we're making today between rehabilitation care and custodial care? Thank you for that good question. Someone else probably has that same question. So in order for Medicare to cover any part of a skilled nursing facility care stay, Medicare only pays when the individual is in long-term care for rehabilitation purposes. Let me give you some examples and see if it helps. So if a person has a slip and fall on black ice, they fall, they fracture an arm, they go to the hospital, the arm gets set, and if they need rehabilitation to learn how to exercise and use that arm again following a fracture, or a hip replacement, if an individual has a hip replacement, they're treated at the hospital for the hip replacement. And from the hospital, they go into long-term care to learn how to walk again on the hip that's been replaced. That's rehabilitation. Sometimes people who have strokes need speech therapy following a stroke. They might be treated at the hospital and released either to home or to a long-term care community and receive speech therapy. That's rehabilitation in nature. So it's a great question. If Medicare only pays when an individual is in a long-term care community for rehabilitation, right? Learning how to walk, talk, speak, following a medical condition. Custodial care, on the other hand, I often think of my clients with memory impairment. Uh, think Alzheimer's and other dementias, or that's a progressive condition. Many people are able to stay at home after an initial diagnosis of Alzheimer's or dementia. But as that disease progresses, oftentimes it becomes, from a safety perspective, the only safe place for the individual to reside 24 hours a day is in a long-term care, memory care community, that sort of thing. So that's what I think of for custodial care, when that becomes the individual's long-term residence, because
You're fine.
sometimes it might be a person. I've had clients who double amputee, a client with diabetes. Once he had his second leg scheduled for amputation, he made the decision that he was going to enter into a long-term care community for the rest of his life. He was rather young and he didn't want to burden his family members with the care that he was going to require after his second amputee. So that's my definition of rehabilitation and custodial care. I hope that is helpful. And we will be distributing the slides following today's program, Jason. Thank you for jumping in with your good question there.
So what do you consider the last case to be, custodial or rehabilitative?
I'm sorry, can you repeat the question, please?
What do you consider your last case of amputation to be, rehabilitative or custodial?
Oh, that's a great question. I love your attention to the detail. In that last example that I gave of the person who had both legs amputated, I imagine that individual would probably get maybe 100 days paid for by Medicare, right? As he's learning to this has been years ago, so I don't really remember the details of that specific case, but could have some Medicare coverage for the first 1 to 100 days. And then after that, days 101 through eternity, the individual is either going to privately pay, or long-term care insurance might pay, or the reality is Medicaid will likely pay for an individual who resides very long in a nursing home. There aren't very many of us who can afford $108,000 a year before exhausting a lifetime of savings. So that's really where the majority of our time. I think we're going to switch over here. And by the way, I will stick around after today's program. If there's any questions that we don't get answered during our scheduled time, I'm happy to stick around, and hopefully we can have a great discussion at the end of our 1.5 hour scheduled time. Let's switch over to our second topic today, and that is Medicaid coverage of long-term care. As I've indicated, Medicaid pays the majority of long-term care costs in the United States, anywhere from 54 to 57% nationally is paid for by Medicaid. Insurance companies pay for about 26% of the cost, and individuals privately paying are about 13%. So let's talk about Medicaid. Once again, there's going to be a big general rule Medicaid's big general rule is that Medicaid is the payer of last resort. Medicaid only pays if there's no insurance to pay and an individual has exhausted their savings. Every state in the nation has their Medicaid savings limit. In Kansas, it's $2,000. In Missouri, it's $5,035. So the big Medicaid general rule is that they won't help pay the nursing home bill until an individual has less than $2,000 in savings. I think that's why sometimes I hear, isn't Medicaid a program for the poor? And in that sense, it is. Medicaid only helps pay the nursing home bill if an individual has limited assets. $2,000 in Kansas, $5,000 in Missouri. And so that's the big general rule. We've got really 4 topics we're going to cover, 4 big Medicaid topics. We're going to talk about exempt assets. We're going to talk about Medicaid spin down. We're going to talk about Medicaid's division of assets, and we'll talk about some of Medicaid's income rules. So let's cover this next slide and we'll take a pause, take some questions. I do want you all to know after today's training that Medicaid allows, there are 5 exempt assets. 5 assets that Medicaid allows a person to have in addition to their $2,000 in countable savings. Okay. The first exempt asset is the residential home. The Medicaid applicant does not need to sell the family home in order to receive Medicaid assistance. And I get that question a lot at my office. People call and say, my husband's gone into the nursing home. Do I need to sell the house in order for Medicaid to help us? And the answer is no. Whether it's a single individual or a married individual, a Medicaid applicant does not need to sell their house in order for Medicaid to help pay the bill. That's because the house is one of the exempt assets. It's not counted by Medicaid when they're trying to determine whether this individual applying for benefits has more than $2,000. Okay. I think it's important for us to know that while the house is an exempt asset, while the person is living, the house is subject to Medicaid's estate recovery lien after the death of the Medicaid recipient and his or her spouse. So the house is exempt while we're living, but it is subject to Medicaid's estate recovery after the death of the applicant and his spouse. The second Medicaid exempt asset are the household goods and personal belongings. What do we mean by this? Well, ladies, we can have some jewelry with some value, but our jewelry, our wedding ring, and other items of that nature are one of the exempt assets. Medicaid is not going to calculate the value of our jewelry or the gentleman's tools. Tools can have some real significant value, or our home furnishings, our antique furniture and lovely artwork. All of these items are exempt assets, exempted by Medicaid, and not counted towards that $2,000 limit. The third Medicaid exempt asset is 1 vehicle per household. An individual, most vehicles today have a value of greater than $2,000, that general savings limit. But because 1 vehicle per household is exempted by Medicaid, the individual doesn't have to sell the car to take advantage of Medicaid assistance. And prepaid funeral plans are an exempt asset. Prearranged and prepaid funeral plans, Medicaid will exempt and not count towards the person's $2,000 savings limit. Couple of things that we ought to know about the funeral plans. They must be irrevocable. And that means the individual can't change their mind and get their money back later. Many of my clients bought funeral plans years ago, and when it's time for them later in life to apply for Medicaid assistance, they need to sign an extra statement of irrevocability that the funeral plan will gladly provide. And Kansas Medicaid puts a limit on the funeral services. Kansas Medicaid says the services themselves should not exceed $7,000. That's usually not a problem. The real cost of funeral homes is more in the products, such as the casket and the urn and the headstone or monument. And all of those funeral products do not have a limitation like the services do. And by the way, I don't know if you all know I've been surprised over the years by the cost of funeral homes or funeral plans. You know, it's not uncommon for a person to spend $7,000 to $12,000 on a funeral plan. So I think it's helpful to know that Medicaid allows people to purchase a prearranged and prepaid funeral plan as a part of the Medicaid spend down. And the fifth exempt asset is life insurance. And life insurance may be exempt. It depends on the type of life insurance policy. If it's life insurance that has zero cash value, then it's an exempt asset. And so term life insurance, an individual might have $1 million term life insurance policy. And because the term life insurance policy has zero cash value, Medicaid exempts that asset. Now, if it's a whole life policy, whole life insurance policies do accumulate a little bit of cash value over the years. And if the cash surrender value of all life insurance policies exceeds $1,500, then the cash surrender value of the life insurance will be a countable asset, not one of the 5 exempt assets. So these are our 5 exempt assets. They're not considered or counted by Medicaid when Medicaid is trying to determine if this individual has more than the $2,000 allowed by the general rule. And I think we'll take a pause here, see if there's any questions or comments. Yeah, so thank you. We've got a good question in the chat. I want to share it with the full group. The question is, when this individual worked in a nursing facility, if a single individual lived alone, they had to put their house up for sale if they plan to stay in long-term care. Is that still true today? And the answer is yes and no. We're going to hear that a couple of times today, yes and no. So the individual Medicaid might want, after a year of, there's an annual review process, I think might be what you're speaking of. When individuals are approved for Medicaid, there is an annual review. Every year, the individual needs to demonstrate that they still have less than $2,000 at the end of every month, and that they haven't won the lottery or received an inheritance that could be paying the nursing home, right? There's an annual review for Medicaid continuing qualification. And sometimes Medicaid, after that first year or more of nursing home payments, Medicaid might require or ask the individual to sell the home, make their best efforts to sell the home. I want you to know that as long as the individual is making their best efforts to sell the home for its fair market value, the home will continue its exempt status. Yes, and that's been someone jumped in the chat. As long as the property is listed for sale, Medicaid is generally satisfied that the individual is trying to convert their exempt asset into a countable asset that can be used to pay for the nursing home costs. Oh, here's a good question. Jana says, what happens if a son or a daughter lives in the home while the Medicaid recipient is in long-term care and no spouse in the picture? Jana, I love your question. There is something, we call it the child caregiver law. That's just a colloquial name that we've given this federal statute. There's a federal statute that says if a Medicaid applicant, if an adult son or daughter has moved in and resided with an aging parent for the 24 months immediately prior to the parent's nursing home placement, that individual can transfer ownership of their home to that adult child caregiver. And I think it's because Medicaid realizes when adult children are willing to move into the senior person's residence, that senior person is going to be able to stay out of the extraordinarily expensive nursing home care for longer than they otherwise would have. So Jane, I like your question. When there's an adult son or daughter that's lived in the home, the Medicaid applicant may be able to transfer the house to that adult child without a penalty period. Oh.
Karen, it looks like we got a couple more questions in the chat too.
Okay.
I might start at the top here. So Jennifer wants to know, and I think a lot of us want to know, is why does Kansas have such a low amount when it comes to our, I think it's our exempt assets? Why is it only $2,000?
Thank you for that question. So Kansas has been $2,000. Actually, Missouri's $5,000 sounds very generous, but Missouri's Medicaid asset limit was $999.99 for decades. And only through the efforts of advocacy groups like KABC and others, eventually Missouri raised their asset limit from $1,000 to $5,035. It's just a part of that. It's not uncommon for a lot of these federal programs. There's, various limits when the statutes get created, and then 20 years go by, and $2,000 today is not the same as $2,000 20 years ago, that's for sure. But some of these statutes that set these savings limits did not have a tie-in for annual increases to catch up with the cost of living adjustments like Social Security does. So that's why our Kansas limit is so low. It was set in place years ago, and the enabling statute didn't provide for annual updates as the cost of living gets higher for all of us.
Yeah.
In my opinion too, once you've spent down a lifetime of savings, if you're requiring nursing home care and you're spending down your assets, at the end of the day, there's really not a great deal of difference between 2,000 and 5,000 if that's all you get for the rest of your life. And does the exempt residence rule, another question for the group, does the exempt residence rule apply if you purchase a share in a residential co-op? That's a great question. Thank you, Julie. Yes. A residential co-op would be an exempt asset. I don't want to get too thick in the weeds here, but Julie's good question makes me think of, there are entrance fees for some of our assisted living communities and senior apartment complexes. And sad to say, sometimes the entrance fee for these senior retirement communities, the CCRCs, the continuing care retirement communities, sometimes those entrance fees are a countable asset. But Julie, to answer your question, a residential co-op is an exempt asset like a traditional home. Rachel, thank you for your good question. Rachel said that she's heard a Kansas Able savings account is also an exempt asset, and it is true. Yes, Rachel, that's correct. Able accounts, which are a special kind of savings account for individuals who have been determined to be disabled by the Social Security Administration. Able accounts are an exempt asset. That is correct. We had another question here, Stephanie. If life insurance is more than $7,000, do they put a lien on the remainder of the benefit? And so, no, Medicaid doesn't put a lien on life insurance. What they do, if the cash surrender value of life insurance is greater than $1,500, the individual is going to have to cash out the policy and spend down the cash value, or assign the policy to a funeral home to help fund that prepaid funeral plan, or borrow against the life insurance. I've had some clients borrow the cash value, maybe buy the prepaid funeral plan. But the short answer to your question is that no, Medicaid does not put a lien on life insurance proceeds. There's another question. Thank you all for participating. What if life insurance surrender value is $3,000? Is it $1,500 or the entire $3,000 that's accountable asset? Great question. So $1,500 is the exempt or allowable amount of cash surrender value. So Louise, in your example, a $3,000 cash surrender life insurance policy, a couple of different options are going to be available to the individual. They can cash out the policy, receive the entire $3,000 cash surrender value and spend that down, or they can borrow $1,500 from the $3,000 cash surrender. They can borrow $1,500 of the cash surrender value, spend that $1,500 down, or they can assign the policy to a funeral home. I will say when if a client under your example, Louise, a $3,000 cash surrender value life insurance policy, one of the problems about pulling out borrowing $1,500, just enough to get below the $1,500 exempt cash surrender value, that's something the applicant or recipient is going to have to stay up on each year. And cash surrender value generally increases in value very slowly. So a couple of different options for cash surrender value life insurance. I like talking about the life insurance though, because it's something that you want to look into early, in my opinion. If you're anticipating maybe needing Medicaid in the future, you probably want to look into the life insurance early. I've seen cash surrender value cause a lot of people to be ineligible for Medicaid assistance kind of at the last minute. It got overlooked or neglected. And so that's why programs like our session today are very helpful. And yeah, oh, I like this question too. Really like Jessica's question. Thank you, Jessica. asks, is a spouse able to move to a new residence after the other spouse has gone into long-term care? Maybe they want to downsize, move into a smaller residence, maintenance provided, maybe even apartment living. And the answer is yes. And that's a really good question. I think it's really important for all of us to know the spouses of nursing home residents are not stuck in that residence just because their spouse has gone into long-term care. Maybe they've made an application for Medicaid and Medicaid is helping with that extraordinary financial cost. But the spouse who's still in the community, it's called a community spouse, the spouse that's still living in the family residence, absolutely they can move residence. I like to say they don't become a prisoner in their own home just because the spouse has gone on Medicaid. And yeah, the 24 months for a child living in the residence that's a federal statute. So I don't think that's subject to state interpretation. Kayla asks, is the cash value of $1,500 per policy or the sum of all policies? Really good question. That $1,500 exempt amount is for all policies. And Crystal asks a really clever question. What if the life insurance policy is purchased by a child or other relative? And if the life insurance is not owned by the Medicaid applicant or the spouse of the Medicaid applicant, then it would be an asset owned by the child or other relative, and it wouldn't be a part of the individual's Medicaid application. Okay, are we liking this at all? I like it, I hope. Oh, one more question following up on that. Jessica asks, if they put a lien on the home but can't enforce or collect it until the death of the surviving spouse, is there a process to have the lien removed while the surviving spouse is living? And the answer is yes. Absolutely, Medicaid's lien on the residence can be removed if the surviving spouse sells that residence and buys a new residence or moves into senior. Yes, those Medicaid liens can be removed during the lifetime of the surviving spouse. Thank you for that really good question. So our next topic is the Medicaid spin down. I don't know if you've all heard about that. I get asked, what does that mean? What does the Medicaid spin down refer to? Well, simply put, that is the process, the time during which an individual who's gone into long-term care, if they have more than $2,000 in savings, they're going to have to spend their savings down to that $2,000 limit before the Medicaid application would be approved. So when we talk about Medicaid spin down, we're really talking about an individual who has moved into long-term care and they currently exceed the $2,000 savings limit. So they begin the process of spending down all of their savings to Medicaid eligibility. And I thought it might be helpful for our session today to talk about what are some of the common things that people do as they're spending down their assets. A lot of my clients will trade in the old car and buy a new, more reliable vehicle because they'll be worried about the cost of repairs. And you might recall that one vehicle per household is one of Medicaid's exempt assets. So an individual might buy a newer car, trade in the old car, buy a new car, perfectly allowable by Medicaid. The purchase of prearranged and prepaid funeral plans is a very common Medicaid spin down process. Remember, we said funerals are range in price from $7,000 to $12,000 plus. So if an individual has entered into long-term care and they're worried about becoming Medicaid eligible, one of the things they might want to do is go ahead and prearrange and prepay for their funeral so that the spouse or surviving children don't get saddled with that expense. Again, it's perfectly allowable by Medicaid. A Medicaid applicant can pay off debt, can pay off credit card debt or medical debt, or pay off the mortgage or pay down on the mortgage. There's no penalty or problem for our clients to pay off their debt as a part of the Medicaid spin down process. And an individual can pay taxes and insurance obligations. They can pay any and all taxes, income taxes, real estate taxes, personal property taxes. The payment of taxes and insurance obligations is perfectly permittable. Is that a word? Perfectly permitted by Medicaid as a part of the spin down. An individual can make home improvements or update home furnishings. This made our slide today because so many of my clients who have been leaning on one another, taking care of one another at home, they've neglected some home improvements because they've been worried about the extraordinary cost of long-term care. So once an individual has entered into long-term care, if there's any necessary improvements that have been delayed or neglected, those items can be provided and paid for as a part of the Medicaid spin down. And I put on the slide today that an individual can even take a long overdue vacation. And that might seem silly or sound frivolous, might sound like it doesn't have a place in a discussion like today. But obviously this is probably for a community spouse, the individual who's gone into long-term care, skilled nursing facility care. They're probably not able to take a vacation, but perhaps his or her spouse, who has been in all likelihood taking care of that individual for a long time at home. Once that difficult decision for long-term care placement has been made, a community spouse can take a vacation as a part of Medicaid spin down. I guess the real important point here for us all to know is that anything the individual does as they're spending down their assets, anything they do for fair market value will not create a problem. There won't be a Medicaid penalty period. As long as the individual is using their money and purchasing things and receiving an item of fair market value in exchange. The only real thing that'll get you in trouble is gifts to kids or grandkids. And we'll talk about that here in a couple more slides. I think we'll finish this slide here regarding additional spin down considerations, and maybe we'll pause and take some questions. I do want to be sure everyone understands the timing of when should a person begin spending down their assets for Medicaid eligibility. I don't want anyone in the group today to run out this afternoon and start buying new cars and new homes and funeral plans for themselves if they have not yet entered nursing home care. Remember, we really don't want to start spending down the assets until the individual has entered into long-term care, which means they're going to spend at least 30 consecutive days in long-term care and they're not expecting to come back home. Okay, so the timing of when do we begin the spin down can be very important. Generally, it doesn't count until, as I indicated, someone has entered into long-term care. There is a little caveat I've put in the materials today regarding our HCBS Medicaid. And my apologies, I should have spelled that out. Home and community-based services. That's HCBS stands for Home and Community-Based Services. It's a special kind of waiver program. It's assisted living is available. Medicaid assistance for assisted living is available if the assisted living facility participates in the HCBS Medicaid waiver program. And so for HCBS Medicaid, the spin down doesn't begin to count until the individual has been assessed and determined eligible, that in need of long-term care, and they're eligible for an HCBS waiver program. One final note I want to share about the spin down. Please know that an individual, as they're spending down the savings, for a married couple, they can spend down the assets on anything for either spouse. Oftentimes people think, oh, I have to spend half of the savings on my spouse in the nursing home, meaning simply payments for his nursing home care and his depends. And I just want you all to know that Medicaid allows a married couple to spend down their assets on anything for either one of the spouses. Doesn't have to all be spent on the nursing home spouse's needs. And I love this one. How many of you in the room have heard, can't I just give all my money to my kids and apply for Medicaid? I've heard that once, if not 100 times over the years. And the answer is we can't just give all our money away to our children and go apply for Medicaid. Doesn't work like that. If an individual makes gifts to their children or other family members, the Medicaid application asks, have you sold, transferred, or given away any property or assets within the last 5 years? So if an individual applying for Medicaid has made gifts to the children, they must reveal those gifts to Medicaid. They must document those gifts for Medicaid, and Medicaid will determine a period of ineligibility, sometimes called a penalty period. And so can't just give all your money away and expect Medicaid to pick up the nursing home bill next month, right? Doesn't quite work like that. And I think we'll pause there for a moment, take some questions. Let's see. Okay, as a part of the spin down, the question is, can a person buy art or new personal jewelry during the spin down? That's very clever, Donna. And I suppose the short answer is yes, a person could buy jewelry or artwork as a part of the Medicaid spin down. I'm not sure I would recommend that, but is it possible? Sure, it's possible. I'll share a story with you. I represented a client whose daughter lived here in Lee Summit, and her folks were from Arkansas, I believe. They were from Arkansas. Her parents were they had a 50th wedding anniversary coming up. Clients had a 50th wedding anniversary coming up. They had been talking about and planning a trip for the whole family, 3 kids and all the grandkids. The married couple wanted to pay for that. And also the gentleman had picked out a beautiful new 50th anniversary wedding ring for his wife. And then he got very ill, and I'm embarrassed. I can't remember what the medical condition this individual had, but it came on quick and acute. And this gentleman just went downhill, physically went downhill quickly. And they ended up placing him in long-term care here in our region. I think because the daughter was here and was going to be helping with the care in a lot of ways. And so the family, when they contacted us, they explained that, they had this family trip that had been planned long in advance and the deposit had been made, but the final payment had not yet been made. And they also had a receipt for the ring, similar thing, a deposit, a down payment on the ring had been made, but the balance had not yet been paid. And those individuals were able to complete the family vacation that had already been in process and complete the purchase of that 50th wedding anniversary ring. So that's one time, Donna, when I had a client purchase jewelry as a part of the spin down. I didn't recommend it as a part of the spin down, and I don't think that I would, but sometimes, the situation was these things were already in the works before an acute medical event happened. Somebody wants to know, and this is a really good question, can we prepay in a facility? And it's a great question. Medicaid doesn't really like prepayment. Yeah, isn't that a booger? I think that's a legal term, booger. I'm not sure. Yeah, Medicaid doesn't like prepayment for long-term care costs. And that's a real problem for the HCBS Medicaid applications. For our nursing home applications, prepayment isn't as often an issue because Medicaid will will go back retroactive and begin payments to the first date of the month in which the Medicaid application was made, if the individual met all of the eligibility requirements. But you want to be very careful about prepay. And I'm going to say short answer for today's program is we can't prepay for our long-term care as a part of the Medicaid spin down. So I'm scrolling through can you all see these chats that I'm seeing on my screen? One of the questions in our chat is a lien, does Medicaid place a lien on the house for HCBS services? And the answer is yes. HCBS is a part of the Medicaid program, and Medicaid has a right to assert a lien against the property owned by the Medicaid recipient at their death. Does Medicaid take the individual's, oh, this is good. Does Medicaid take the individual's monthly Social Security payment to put toward the cost of the nursing home facility? And the answer is yes. Pam, thank you for that good question. I think that's coming up on our, well, anyhow, there's a later slide. Let's go ahead and jump to our slide about income. I want you to know, so we've been talking about assets so far, right? Savings account and houses and vehicles and funeral plans and life insurance, all of those assets, the things that we own. And of course, Medicaid has rules about our assets. I also want you to know after today's program that Medicaid has special rules regarding income, regular monthly income. Like Pam's question, she wants to know, does Medicaid take the individual's Social Security and pension income? And the short answer is yes. Well, to be more precise, Medicaid requires that an individual wanting to receive Medicaid assistance for their long-term care, that individual must be willing to use their own monthly income to help pay the cost of the nursing home bill. I think of it as like a copay. So Pam, if an individual is receiving Social Security and a pension benefit, and they've entered into nursing home or long-term care, once they've spent their assets down to $2,000, Medicaid will help pay the nursing home bill, but Medicaid requires that the individual use their Social Security and pension income and pay those amounts over to the nursing home, sort of like a copay, and then Medicaid negotiates and pays the balance of the bill directly to the nursing home. I want you all to know, a lot of people, even after I've worked with them for weeks and months, sometimes I still get this question. People want to know, does Medicaid take the Social Security income, or does the nursing home take the Social Security income? And the answer to that question is no. The Social Security and pension income will continue to be deposited into the individual's bank account like it always has. And then Medicaid the individual will write a check to the nursing home based on the amount of their Social Security plus pension. We're here, we might just mention Medicaid allows an individual to keep $62 each month from their Social Security check. That's supposed to cover all their personal needs for the month. So there's a $62 a month personal needs allowance that Medicaid provides for. Medicaid does allow an individual to pay the cost of all of their health insurance premiums, Medicare supplement, dental insurance, vision insurance, any health insurance premiums can be paid from the individual's Social Security and pension before the balance of those monthly income get paid over to the nursing home. So, so Susan is asking, is it legal for a long-term care facility to hold the SSI income for a resident and pay themselves monthly? And Susan, that is certainly can be legal. A lot of people who are disabled, if they don't have a spouse or other family members to assist them, sometimes long-term care facilities do become representative payee for a resident's Social Security benefits. And there is an annual report that they would have to file with Social Security to show Social Security how they're using the monthly benefits for the benefit of the individual. But yes, it's legal. It can be done. Since we've switched over here to talk about income for just a moment, let's finish up. Remember, here we're talking about income. We're kind of off of the subject of assets. We've learned that there is a patient liability amount that Medicaid requires individuals receiving assistance to be willing to use their Social Security and pension income. And that's true for a single person or a married person. For married couples, there are some other additional income protections that Medicaid provides. For a married couple, if the community spouse, that's the terminology that is used for the spouse who's remaining in the family residence, the private residence, while her husband's gone into long-term care. There's a minimum monthly maintenance needs allowance. We sometimes call this the MMMNA. I put that in the materials for you today. Minimum monthly maintenance needs allowance. It's basically a poverty level of income. And Medicaid says that every community spouse married to a nursing home resident ought to have a minimum monthly income of $2,465 a month. And if the community spouse, the spouse staying at home, if her monthly income is not that much, if she doesn't receive $2,465 in her own name, Medicaid will allot a portion of the nursing home spouse's income over to the Medicaid or to the community spouse, whatever amount is necessary to bring that community spouse monthly income up to this $2,465 level. So what do I mean? Let's say the community spouse receives $1,000 a month in Social Security benefits, and her husband's gone into the nursing home. If at $1,000 a month income, she's $1,465 below the MMMNA. So her nursing home spouse, Medicaid will allow that nursing home spouse, instead of paying all of his income to the nursing home, like the general rule provides, Medicaid will allow this individual to allocate $1,465 to his spouse, reducing the amount that he is required to pay over to the nursing home. That's a special income protection for married couples. And this amount, there is a maximum monthly maintenance needs allowance. The minimum is $2,465. The maximum is $3,853. That maximum amount generally is only allowed when there are excess shelter expenses. For example, a mortgage obligation that is still outstanding, or perhaps rental expenses at a senior apartment. If there are excess shelter expenses, the minimum monthly maintenance needs allowance can be increased from $2,465 up to a maximum of $3,853. So would that include utilities? So thank you, Jeannie, for your good question. The excess shelter expenses, that's a defined term. Medicaid tells us what is an excess shelter expense. So the $2,465 figure includes Medicaid, that's based on a formula that Medicaid uses. And the excess shelter expense is tied into, there's a utility allowance that gets factored into those calculations. I can't remember what the utility allowance is. Usually that alone will not allow a higher community spouse monthly maintenance needs allowance. I have had a community spouse monthly maintenance needs allowance be increased when she had expensive medical expenses for herself each month that were quite extraordinary. So generally it's for excess mortgage and rental obligations. Let's see, what did we skip over? We skipped over division of assets. Division of assets is a Medicaid terminology. People want to know, what is the division of asset? We're going to talk about that today. First of all, I want you all to know the Medicaid's division of asset is only relevant for married persons. one day I was diligently working away on a Medicaid application at work, and I was all worried about whether I had the proper documentation for Medicaid's division of assets. When it dawned on me that I was working at that time for a single individual, and single people applying for Medicaid do not get to divide their assets. Only married couples get to divide their assets. You might find it interesting, I do, that prior to 1988, when one spouse of a married couple moved into nursing home care, that couple had to spend all of their savings down to the $2,000 limit that we've been talking about. And that since 1988 and the passage of the Medicare Catastrophic Coverage Act, married couples are now allowed to go through this division of assets, protecting some of the assets for the healthy community spouse so that we're not impoverishing two people. We want that community spouse to have some savings to be able to provide and pay for herself or himself, while the other spouse is residing in the nursing home. So, division of asset, what is it? The way I describe the division of assets, please let me know if this is helpful. I say that Medicaid we say they take a snapshot picture of the couple's countable assets as they exist in that first month when one of them enters into long-term care for 30 consecutive days. Medicaid wants to know, what did this couple own together? His, hers, both, doesn't matter. Medicaid looks at a married couple as one financial unit. So Medicaid wants to know about the assets owned by either spouse in that first month when one of them enters long-term care that's expected to last 30 consecutive days or more. And so that's the total of assets that Medicaid's going to divide in half. Let's say the couple has $300,000 in countable savings. Dividing 300,000 in half is 150,000 for each spouse. The nursing home spouse is supposed to spend his or her savings down to $2,000, and the healthy community spouse gets to keep the other one-half of the assets. It is important to know that Medicaid puts a cap, a maximum amount that can be protected for the community spouse. That today, this year, it's $154,140. That amount is tied to cost of living adjustments, so it goes up a little bit each year. So what do we mean by that? Let's go back to our example. Let's say there's a married couple. One of them has gone into nursing home care, and all of their countable savings that month when one of them enters long-term care, let's say it's $500,000 that the couple has, $500,000 in countable savings. Well, dividing 500,000 in half would be 250,000 for each spouse. Regrettably, Medicaid puts a cap. The community spouse the maximum amount Medicaid allows her to keep is $154,140. Everything over that amount, all the other $350,000 must be spent down to $2,000 before Medicaid will help pay for the spouse's nursing home bill. So I say it's not a pure division of asset. It's a division of asset with a cap at $154,000. And oh, one other thing that I think is really helpful to know, there's a minimum community spouse resource allowance, a minimum amount of savings of $30,828. I put this in the materials because when a married couple has less than $30,828 in savings, The couple doesn't need to go through a division of assets. There is no spin down of one half. And that's because in reality, this $30,828 is kind of a poverty level of savings that Medicaid says our community spouse is going to need at least $30,000 to live for the rest of her life without becoming another burden on the Medicaid payroll, right? So if you have less than $30,000 and you're a married person, you won't have to go through the division of asset that Medicaid generally requires. You can see we talk about a lot of general rules and then exceptions to the general rules. That's kind of the way of Medicaid. And so I hope it's all been tracking and it's been of interest to you all. Oh, we do have some chats. Good. Let's get some good discussion going. Okay, Bonnie. For those of us who can't remember all of this info and cannot afford an expensive attorney or financial planner, who do we go to for answers to our specific Medicaid related questions as they arise? Yeah, boy, Bonnie, I don't know what to tell you for that, you know. I think that I'm grateful for the internet that we have today. You know, we can, all of us can do some research on our own using the Google or whatever it is that you use. You know, but we know that everything on the internet isn't always accurate, right? And I'm going to tell you that even I wish the agency were available to take questions, but they're not. And I don't know that you'd get a correct answer. It really kind of probably depends on who you get that day, right? So, you know, I don't know, Bonnie, where else? Kansas Advocates for Better Care. You can check out, you know, organizations like that. Should the division of assets occur prior to the nursing home stay? And thank you, Jeannie. The answer is no. Really good question. And you're very intuitive to realize that the timing of when do you begin the division of asset, that's always an important question, a very common question. And you don't start the division of asset until one person of a married couple has moved into long-term care. So we don't start the division of asset until somebody has moved into long-term care. Would it be best for a couple to apply for Medicaid as soon as one enters a facility, or should they pay private for a while if able and then apply for Medicaid? So really good question. These are the kinds of questions we ask ourselves around here, Kayla. I would say, but I generally recommend to individuals, don't apply for Medicaid until you've gathered all of the documentation. Okay. So the Kansas Medicaid application today is 32 pages long. And but it's based on an input, you know, there's a computer algorithm, you know, and 32-page application by itself is not going to get a quick and efficient Medicaid approval. You need to be prepared to supply supporting documentation for nearly every bit of information that you fill in on that 32-page Medicaid application. Medicaid wants supporting documentation. They need verifying documentation. So it's not something that I suggest that you just do quick down and dirty just because somebody's moved into the nursing home. I think that it would behoove us all to be a little more thoughtful about that. Make sure we've completed the application correctly and gathered all the supporting documentation that Medicaid's entitled and should review as a part of the eligibility determination. And generally, Kayla, I do think a lot of people, most people do private pay for a period of time at the nursing home before applying for Medicaid assistance. It would only be those individuals moving into the nursing home who have less than $2,000 that would be immediately eligible. So most of us do privately pay for a period of time at the nursing home before seeking Medicaid assistance. And what about a house that is paid off? Yeah, so what a question from the group is, what about the house that is paid off? Let's see, what have we learned about the house? We know it's one of Medicaid's exempt assets. So a house is worth more than $2,000, but because it's one of the exempt assets, an individual can still own the home and be eligible for Medicaid assistance for their nursing home care. Now, if there's a renter in the house, and the individual who owns the house, who's living in the nursing home, if the house is being rented, the rental payments will be added to the individual's Social Security and pension income and increase the amount that the individual pays to the nursing home as a part of their copay. The real Medicaid term is a patient liability amount. So I'm not sure if that answers the question about the house. We can stick around and come back later if there's more questions about the house. Oh, and Jeannie, thank you. Jeannie makes a helpful suggestion. Somebody asked earlier, who can we go to for Medicaid questions like this? And the area agencies on aging might be a good source. Thank you, Jeannie, for that suggestion.
Karen, I also added, there's a free resource called the Senior Health Insurance Counseling for Kansas, or their acronym is SHIC. And they're a great resource. They provide, they have trained volunteers that will answer any of your questions about Medicare or any other sort of senior care insurance. And I put a link for their information in the chat too.
Thank you, Libby. That's really helpful. The SHIC that Libby is talking around, they are a very helpful source. They've been around for a long, long time, and it's a great resource. Lynette also asks whether the MCOs, the managed care organizations, will take Medicaid questions. They might, Lynette. We have 3 managed care organizations who have contracted with Kansas Medicaid. What are they? They're Aetna, Sunflower, and United Healthcare. So they're called MCOs, or managed care organizations. They're Medicaid contracted organizations. Rachel, I think you were the one that was asking, where can we go? You might try the managed care organizations. It's kind of tricky getting their contact information, but I'm sure they publish something for regions. And Lynette also suggests that we might reach out to our Kansas ombudsman. And we do have a great ombudsman program in Kansas, Lynette, and the Kansas ombudsman might have good resources and to answer questions about Medicare and Medicaid. Thank you, Lynette. Let's see, Sherry has a question. On Medicaid asset recovery, is there any room for negotiation based on the efforts of the family made to keep their family member out of the facility? Is there any special consideration given? Sorry. I lost it, you guys. So, first part of the question is regarding Medicaid's estate recovery at the death of an applicant. Yes, Medicaid will negotiate. So Medicaid has a lien for the amount of benefits that they paid. Let's say an individual owned a home worth $300,000. Medicaid paid $150,000 in benefits during that individual's life. When the individual passes away, Medicaid has a lien against the home, but only to the extent of the $150,000 in benefits that they paid, right? It's not like they get the house just because they paid benefits. They have a lien for an amount of benefits that they paid. And Medicaid will negotiate with surviving family members. Yes, I have found Kansas Estate Recovery Unit to be reasonable, and they will negotiate with family members in an effort to reduce the full amount of the lien. Yes, that is possible.
Hey Karen, I have a quick question before you go on to these other ones. If we're still talking about resources, I got a message about, do you think the elder law hotline through Kansas Legal Services could help with those sort of questions? I know the elder hotline provides, free legal questions for anyone over the age of 60.
Yeah, they might, Libby. I think it's worth checking out our Kansas Elder Law Hotline. They may answer questions about Medicaid. I don't know. I have been a volunteer on that hotline years ago for a number of years. I remember I had a lot of landlord tenant, but they might be a resource for Medicaid questions. Jennifer, I really appreciate Jennifer from Ascension Living has reached out in the chat and mentioning the PACE program. We love the PACE program, and we just don't have enough of it, right? So the Medicaid staff, I still think, yeah, I don't know. Whether Medicaid, there is a 1-800 number for CanCare, so you could certainly call and leave messages. Just don't know. It's a lot of, I will say, CanCare makes a lot of wrongful denials of benefits, so kind of have to be careful where we get our info, right? So I think we have covered all of our slides. I'm more than happy to stick around and maybe have a discussion. I do want to mention long-term care insurance just very briefly because we indicated that we would. I'm a big believer in long-term care insurance if you can afford it, if you qualify, if you don't have a pre-existing condition, if it doesn't affect your standard of living. I believe in long-term care insurance. Many of my clients have a pre-existing condition, so they can't get a policy to cover their nursing home care. For those of us that might be looking into long-term care insurance, I recommend that you include home health coverage and assisted living. Some of the old policies didn't cover home health aides or assisted living. They only paid for the skilled nursing facility care. And most of us want to stay at home as long as we can. So be sure policies that you might look at include home health and assisted living care. And for people with pre-existing conditions who can't get insurance coverage for nursing home care, sometimes those individuals will pursue estate planning that includes trusts. We have special needs trusts for people with disabilities and irrevocable trusts. So some estate planning, trust planning might be indicated if a person wanting long-term care insurance but can't find a carrier to write a policy for them. So I'm just so grateful for everybody signing up and participating today. I think we've got a few more questions in the chat. Oh, good one, Julie. Julie wants to know, is there any Medicaid support at all for in-home care? And the short answer, Julie, is that there's very little Medicaid coverage for in-home care. At least for our frail elderly population. Yeah, I wish Medicaid really doesn't pay for very much care in the home, I'm sorry to say. And you still have to go through the division of asset and the spending. You still have to have less than your $2,000 of assets. I wish there was more in-home care paid for by Medicaid. Save everybody a lot of money. And someone is indicating that, yeah, not surprisingly, CanCare doesn't want to answer hypothetical questions. They're more than happy to answer questions regarding a pending application. Any other questions? Comments? Well, at Kansas Advocates for Better Care, we want to encourage you, maybe consider joining our membership. If you found today's training session helpful, we always host every September. We have our annual membership meeting and a training session. I've attended the last 2 years and I found them to be very informative. We encourage you to become a member of KABC so that you can get information and invitations to future training sessions. We value your input. Please, if you would, take a moment to share your comments with us, what you liked about today's session, what you didn't care for, other topics you might be interested in receiving training on in the future. You can always consider a tax-deductible contribution to KABC if you're so inclined. I personally have really been looking forward to today's program, and I honestly, I wish we could be in person, but you know, what a great day for all of us to participate virtually.
Well, thank you so much, Karen, for your presentation and all the excellent information that you shared. I'll be sure that everyone that's attended and is signed up will receive a recording of today's presentation, as well as the slides from today. And I believe, Karen, you have an excellent one-page handout that's a PDF that we'll also include in the email to everyone today. Wanted to thank Karen again, and thank you for everyone that attended and asked your questions in the chat or out loud. And we really appreciate everyone today. And hope everyone stays warm and safe in this winter weather. It sounds like it's going to be a cold one this weekend.
Thank you, Libby.
And I think with that, I'm going to go ahead and stop recording.